Good morning, everyone.
Good morning.
Hello.
Yes, madam, you can go on. We can hear you clearly.
We can hear you.
Okay, fantastic. Good morning, everyone, and welcome. Welcome to your mental health and your human rights. And today, we're really excited to have everyone join us, and I'm looking forward to the conversation. It's a conversation that we normally do not have. So my name is Osayi Alile. I'm the moderator for today. I welcome everyone, and it's a conversation we just normally do not talk about. And I'm glad that the IOD has mentioned that it's something that is important to us as executives. And today we have really amazing speakers. So I'm pleased to welcome you all to this timely webinar, and looking forward to the conversations we're going to have in the next few hours. As leaders navigating the ever-demanding business landscape, I'm certain we all understand that, and we're driven by the relentless purpose and pursuit of success. However, many times we have very limited knowledge about the impact of this pursuit on our well-being, and we've seen it over and over and over again. Many times our mental health and really the wellness of who we are as people is often very silent casualty in our pursuit for excellence. So IOD Nigeria recognizes this critical issue, hence this conversation. We believe that mentality healthy leaders cultivate thriving organizations. Today's discussion is a step towards addressing this growing challenge, and especially after COVID, we know what people have been dealing with. So this interactive webinar is going to help us to equip us with practical tools and knowledge. We're going to unveil the power of mental well-being. We're going to understand what it really means, because a lot of times we look at it in a very negative dimension. And we're going to explore the connection between mental health and leadership effectiveness, building a supportive workforce, discovering strategies to create a positive and well-being focused environment for ourselves and the team that we work with and everyone that we see across when we're doing our work. We're going to address executive challenges. Our esteemed panelists will kind of dive deep into the specific pressures we all face and offer practical strategies and solutions for navigating this. So welcome. And guiding us through this insightful conversation, we have three renowned industry experts, and I'm hoping their videos are on. I can see my sister, Dr. Kadiri. So I'm going to start off with Dr. Kadiri, Dr. Maymunah Kadiri. We fondly call her Dr. May. She's a celebrity strength. She's a multifaceted mental health leader in Nigeria. She's a psychiatrist, a physiotherapist, and the founder of Pinnacle Medical Services, the nation's leading mental health center. When we talk about wellness and mental health, Dr. Kadiri is one of the people that we will always call to the table. And she's been advocating for this for over 20 years. So I want to say welcome to Dr. Kadiri. I'm looking forward to having this conversation with you today. Welcome. I'll move straight into our second panelist, who is Dr. Leonard Chukwuka Okonkwo. Dr. Okonkwo is a licensed clinical. Dr. Okonkwo is here?
Yes, I believe
yes.
it's here.
Dr. Okonkwo is the leading licensed clinical.
Thank you very much. Good morning, everyone.
Welcome, sir. Good morning. And he has an M.Phil in clinical psychology, and he has also earned a diploma in, quite a number of things. We're really excited because he's a counselor with over 30 years experience. He provides supports to relationships in distress and so many behavioral and counseling issues. So we're so excited to have Dr. Okonkwo with you. Welcome, Doctor.
Thank you very much. I'm happy to be here.
Fantastic. Welcome. Our third panelist for today is Dr. Abiola Salami. He's a world-class performance strategist. He empowers leaders across Africa and to excel in their careers and in their ventures. He's talked about things about speaking like a champion, magic of emotional intelligence, and just he's going to help us to guide through the process of the fact that he's been an entrepreneur working in a very, very stringent environment, and how he has also been able to survive and work and balance the mental health of the daily struggles that we see as Nigerians and Africans today. So welcome, to our third panelist, Dr. Abiola Salami.
Thank you. Thank you very much. It's an honor to be here. Thank you.
Thank you, everyone. So, I mean, we have designed this session to be very interactive, and we're going to have our speakers speak for a few minutes. And after that, we're going to ask for questions and comments. I kindly ask that you note down your questions or submit your questions through the webinar using the question and answer function. Your participation is key in creating a very rich learning experience for every one of us. We're all in this together, and we're here to learn and to speak and understand what the process is and what we need to do. So I'm going to hand it over now to our very first person speaking and talking about the elephant in the room, and that is Dr. Maymunah Kadiri. Dr. Maymunah, over to you.
Oh,
Thank
sorry.
you very much. Good
Sorry.
morning. I think
sorry.
somebody said something. All right.
Yeah, yes, the president will need to share
I
with
can't hear
us.
you at all.
Sorry. The chairman of the health committee would welcome our guests, and then the president will speak before the first speaker.
Thank you so much, Thank you. So we'll wait for that.
Okay. Good morning, everyone, and welcome to the first webinar organized by the Health and Social Security Committee of the Chartered Institute of Directors, Nigeria, for 2024. So, first, permit me to recognize the presence of the President and the Chairman of Council of the Chartered Institute of Directors, Nigeria, Alhaji Tijani Borodo, who will soon be giving his opening remarks. Today, we have assembled a panel of distinguished professionals to speak to us on this very important subject, and for accepting to honor this invitation in spite of your very busy schedules. I want to especially thank our speakers on behalf of the committee. Distinguished ladies and gentlemen, what we try to do with these webinars is to scan the environment to identify issues of healthcare or social security nature that are of interest or concern to our members, and to try to enlighten our members on this issue. And so the topic for today's webinar, your mental health, your human right, we believe is very apt today for a number of reasons. The first is that Nigeria is grappling with a staggering mental health crisis today. In fact, the WHO has estimated that about 20% of Nigerians, 20%, which is 1 in 5 Nigerians, will be suffering from one form of mental health issue or the other, mainly depression or anxiety disorder. The second reason that we felt that this subject is very important for our members is the fact that Nigeria continues to deal with broad societal misconceptions and stigma associated with mental health. People who go down with this illness are often labeled as demonic, mad people, witches and wizards. In fact, I recall back in the days, in my first semester at the University of Ife, I observed that anytime anybody did anything weird, chants of arrow, would be in the air. And I was like, what is arrow? Somebody said arrow is a psychiatric hospital in Abiola. So who will want to be caught live or dead, in arrow, hospital. So what this does is that it prevents people from seeking help when they have these conditions. The third and final reason that I want to talk about while we are speaking on this subject today is that our people, Nigerians, have in recent past been hit with what I call major environmental triggers. The recent COVID-19 pandemic is one, and the current economic hardships in Nigeria. These factors pile pressure and stress on executives and on Nigerians in general, and most times push many over the edge. So, distinguished ladies and gentlemen, it is my expectation that you will find this webinar very beneficial, and that at the end of it, we'll all live with better knowledge of this subject matter, with better disposition to speak freely on this subject without fear of stigmatization, and we will be better equipped to deal with this condition. Once again, welcome, and thank you for showing up. Thank you. Is Ms. Alile?
Thank you, Mr. Okonkwo. I can hear you. Thank you so much for that background. And I'm also asking if we have this opening speech by the M.CIoD president, Alhaji Tijani Borodo, to also say a few words. Thank you very much.
Thank you, Mr. Alile. Can you hear me?
We can hear you very clearly, sir.
Thank you very much, Mr. Okonkwo. Thank you, everybody here. Members of the Governing Council and the Executive Committee of the Chartered Institute of Directors, Nigeria, our distinguished panelists, Dr. Kadiri, Dr. Leonard Okonkwo, and Dr. Abiola Salami. Mr. Okonkwo and members of the Health and Social Security Committee of the Chartered Institute of Bankers, Chartered Institute of Directors, fellows and members of the Institute, our valued guests, associates, partners, sponsors, gentlemen of the press, ladies and gentlemen. It's a great honor to welcome you all on behalf of the Governing Council of the Chartered Institute of Directors to this important webinar organized by the Health and Social Security Committee of the Institute. The theme for today's discussion, that is, your mental health, your human rights. It's not just timely, it's apt. It's not only apt, but it's critical. Let me use this opportunity to thank the committee members, ably led by Mr. Okonkwo, for this great initiative. For far too long, mental health has been a topic shrouded in stigma and silence, just like Mr. Okonkwo was saying when he was in the university, the example he gave us. Leaders particularly have been expected to project an image of unwavering strength, often at the expense of acknowledging their vulnerabilities. However, the reality is that mental well-being is not a sign of weakness. It is the foundation for effective leadership and a thriving workforce. Around the globe, mental health issues affect millions of people. According to the World Health Organization, nearly 1 in 4 people worldwide will be affected by a mental health disorder at some point in their lives. This is not a matter that can be ignored or dismissed. It is a public health crisis that demands our attention as leaders of industry. In Nigeria, the situation is no different. Mental health issues cut across all segments of society, affecting individuals regardless of age, gender, or socioeconomic status. Yet, despite the prevalence of these conditions, mental health remains stigmatized and resourced in many parts of the world, including our own dear country, Nigeria. This is one of the reasons why the Charter Institute of Directors thought it right to assemble an array of experts in this field to discuss this all-important issue today. Distinguished ladies and gentlemen, permit me to welcome specially our esteemed panelist, Dr. Maymunah Kadiri, who is the Medical Director and Psychiatrist in Chief, Pinnacle Medical Services, Dr. Leonard Okonkwo, Department of Behavioral Medicine, Lagos State University Teaching Hospital, and Dr. Abiola Salami, a world-class performance strategist and principal strategist, champ. While the moderator will be Ms. Osayi Alile, Chief Executive Officer, Aspire Coronation Trust Foundation. When we talk about human rights, we often think of fundamental freedoms such as the right to free speech, the right to education, and the right to equality. These are normally called social rights. However, mental health is equally critical. It encompasses the right to live with dignity, the right to access appropriate health care, and the right to participate fully in society without discrimination. The United Nations Universal Declaration of Human Rights affirms that everyone has a right to a standard of living adequate for their health and well-being, including medical care. This right extends to mental health, which is an essential component of overall well-being. When mental health is neglected, it can lead to discrimination, social inclusion, and violation of basic human rights. As business leaders and directors, we have a unique role in promoting mental health as a human right. Our influence extends beyond the workforce, affecting the broader society. We set the tone for corporate culture, influence policies, and lead by example. We must promote positive work environment, a positive work environment that values mental health and well-being is very essential. This involves fostering open communication, reducing workforce stress, and encouraging work-life balance. We must ensure that our workplaces are safe places where employees can discuss their mental health without fear or stigma or retribution. A good work environment is great, but providing access to mental health resources is even better. Companies should offer mental health resources such as counseling services, employee assistance programs, and training for managers to identify signs of mental health issues. These resources will help employees manage stress and maintain their mental health. Also, we should advocate for mental health policy in our respective organizations. As business leaders, we can advocate for policies that support mental health at the local, national, and international levels. This includes pushing for better access to mental health services, funding for research, and laws that protect the rights of individuals with mental health conditions. More to this is leading by example. Be open about your mental health struggles if comfortable doing so, and prioritize self-care practices. Demonstrate a healthy work-life balance and encourage employees to do the same. This will help reduce the stigma surrounding mental health significantly and remove the barrier to seeking help. By openly discussing mental health and sharing personal stories, we can break down these barriers and create a culture of acceptance and support. In conclusion, the theme, of today's webinar, that is, your mental health, your human rights, serves as a reminder that mental health is not a luxury. It is a fundamental human rights for each and every human being. As business leaders and directors, we have a responsibility to ensure that this right is upheld in our workplaces and in our various communities. By fostering a culture that values mental health, providing resources for those in need, advocating for supportive, positive policies, and reducing stigma, we can make a significant impact. Ladies and gentlemen, I want to thank you for joining us today, and I look forward to our discussions and shared commitment to promoting mental health as a human right. Together, we can create a brighter, more inclusive future for each and every one of us. I wish us fruitful revelation. Thank you for listening to me.
Thank you so much, the chairman of the council and president and chairman of council, Alhaji Borodo. Thank you so much. You've said so much today, and we're looking forward to having the conversations with our speakers. And of course, we want to say a very big thank you also to Mr. Nnamdi Okafor, who brought this to the front burner, because without us mentioning this thing, we will not be able to discuss it. So we want to say thank you to you. Thank you so much, sir. So we're going to go straight into the conversation for today. I think I'd already preluded myself earlier on and did a lot of the groundwork, and also mentioned a few of the speakers and who they are. So I think we should just go straight into it. And I'm going to call Dr. Maymunah. Dr. Maymunah, we know that today we want our conversation to be interactive, but we want you to also give us from your own point of view and talk a bit about your thinking in terms of mental health. And then from there, we can begin to have a conversation. So I'll hand it over to you, Dr. Kadiri. Thank you.
Thank you very much. Good morning to the Chartered Institute of Directors Chairman, Alhaji Tijani. Thank you very much. And of course, to the amazing team, Mr. Nnamdi Okafor, and every other person, my sister, Osayi, Alile, and all the wonderful participants that joined, and of course, my co-panelists. Yes, the big elephant in the room, and we can't stop talking about this. It's very pertinent that this topic must be heard. We must feel it. We must empower ourselves in the knowledge, because what you don't know, you do not have. And I like the fact that, you know, our host and of course the chairman kind of they've given us some basic statistics and the need for us to understand why we are talking about this today. My mantra is normalizing mental health conversations by building a culture of compassion. And my driving force is to live, to learn, and to impact generations positively. So why are we talking about mental? Why is mental health important? Studies have actually shown that 1 out of every 4 individuals will have a mental health problem in their lifetime. In Nigeria, 1 out of every 5 adults is currently depressed, and UNICEF 2021 said 1 out of every 6 young person has depression. We all have gone through the COVID. We are coming out of COVID in recent times. The first year of COVID, there was an increase, 25% increase in mental health issues. And of course, we all know what that was. The lockdown, the isolation, and all the things that happened. The 3 commonest mental health challenges among Nigerians, and of course globally, are anxiety, depression, and drug abuse. The people you see on the street that have mental health challenges, they are just 1% of people that are having mental illnesses. 99% is you and I on this forum today, and I call it package madness, because as I'm looking at, nobody knows whether I've taken my antidepressant, and I'm right here on board. In 2024, the World Health Organization declared loneliness as a global health crisis. It means that if you are lonely, you are equally like somebody who has taken 15 cigarettes per day. It then means that no matter how much you see people and miss people and they are lonely, that person is as equal as taking 15 cigarettes per day. So no, loneliness right now is a global health crisis. And now we're talking about directors, we're talking about managers, we're talking about the 1% of the 1% of Nigerians. So why is it important in the workplace? Why? Because 2/3 of your waking hours, you spend it in the workplace. So if you sleep for 7 hours, the remaining 17 hours, 2/3 of that you are spending it in the workplace. But despite all these statistics I've just rolled out, stigma and discrimination is so associated with mental health and people living with mental illnesses, including their families, that 75% of Nigerians do not have access to mental health services. So what is mental health? I have to lay this background. So when I define what mental health is, we will understand why it is important and why we have to take cognizance of how much emphasis we have to lay on it. The World Health Organization has defined it in such a beautiful way. And because we are not all doctors here, we are not mental health experts, I'm going to break it down in a very relatable way that we will all understand. And when we go home, we know that, yes, we're taking something away from here. Mental health, I'll break it down into four aspects. Is the ability for you, I, we, us here, the ability for you to realize the potentials in life. Secondly, the ability for you to day-to-day stresses of life. Thirdly, the ability for you to work productively and fruitfully. And lastly, the ability to back to the society or your community. That is essentially what mental health is. And it is said that for you to have mental health is not the absence of a mental health disease. So you may have mental health, but it's not an absence of mental health disease, because when we talk about mental illness, it's a continuum. So there's a distinction between mental health and mental illnesses. Why all of us on this forum have mental health? We do not all have mental illness. So when next you hear somebody talk about mental, wait for the next word that comes. Is it health that the person is going to say, or is it an illness that the person is going to say? If it's health, please pride yourself and say you have mental health. But if it's an illness, then you know that it's a medical condition, it's a medical disease, it's a medical disorder. And like I said, 1 out of every 4 Nigerians will have a mental illness in their life. So there's a sharp distinction between what mental health is, which we all have, and it's different from mental illness, which we do not all have. And mental health and physical health, they are interwoven, intertwined, and you can't take one away from the other. That is why people that have hypertension may have depression. So when we focus on our physical health, we should also focus on our mental health. I know a lot of us do, yearly medicals, but we do not ask for assessment or evaluation of whether we have anxiety, whether we have depression, whether we have sleep issues. We'll do all the blood tests, CT scan, MRI. They are mainly basically physical, but your mental health is very important. And so why do people even have mental health issues? Because that's a very important thing. After I've defined mental health, it's important for me to also enlighten us. Why are you at risk? Who is at risk? What can cause you to have a mental illness? And I will take it from before you were born, childhood, which most times you are not in control of why you are already at risk of a mental illness. And then when you become an adult now, you are a member of M.CIoD, why you should even have a mental illness, or you may even have a mental illness. Some of the causes that make you predisposed to having a mental illness or be vulnerable or at risk of a mental illness is coming from a home where there was loss of one or both parents, coming from a home where there was domestic violence, coming from a home where there's a lot of dysfunctionality. Daddy will say, come, mommy will say, go. Coming from a home where there was positive history of mental illness, and maybe you have experienced child sexual abuse. Now, just tell me, those 5 things I've just said that most times you are not in control of it. Domestic violence, positive family history, and so now you are doing so well. You're a member of M.CIoD, and and you have your house, you have your car, you have your family, and you're wondering why would you have a mental illness? It's because you were already vulnerable. You're already sitting on the fence, and that is the reason why you are at risk of having a mental illness. Now let's bring it home as a member, as a worker, as manager, wherever you are in the workplace. What cannot precipitate you to have a mental illness? And that is where I'll bring the word stress. The reason why most of us go to the doctor, 90% of the cases is because we are stressed. Why you go to the pharmacy to buy medication because you are stressed. Why your pastor, why you call your malam to pray for you because you are stressed. And these are the core precipitating factors that can easily make you to have a mental illness. And I'm going to break it down again because I always want my participants to go away with knowledge that they can relate to. So I'm going to break down the word stress and let us know how you can easily have a mental illness, even though everything is going on well in your life. The first S in stress is self. Sometimes some of us are the reasons why we are dealing with that emotional and psychological issues. Why? Because our emotions drives our thoughts drive our emotions drives our behavior drives our action. People are not going to see what we are dealing with, our emotion, but they are going to see the action and the behavior we present, the manifestation. So it could be you. You are thinking everybody is doing so well except you. So you may be the one having a pessimistic view about life and thinking all is well with others and you are the only one left alone. This journey of life, you are not alone. Life is not balanced. A lot of us are dealing with a lot of issues. The T is trauma. We have all been traumatized, but the issue with trauma is unresolved traumas. And because when people deal with unresolved traumas, they bleed on people that didn't them because hurt people. So if you've been traumatized and you haven't resolved it, you can easily bleed on people and that can easily trigger you. The R is relationships. Our Gen Zers, we call it, we've been saying breakfast. Relationship is the reason why a lot of people are dealing with challenges, disease. You've all been inundated with a lot of information online whereby marriage of 20 years has broken up, divorce here, cheating, infidelity, new couples that just got married 2-3 months are already out of the marriage. So relationship is a big factor that can easily precipitate you or trigger you to have an emotional or psychological problem. The E is economic and financial. I don't know about it, but this is a big problem. We all have seen the FX issue, the no money in the system, the hardship, the global inflation. Economic and financial is a big trigger and a stressor that can easily make you have a mental health issue. The second S is sickness. It may not be you that is sick. It may be somebody in your family that is sick. You are dealing with aged parents. You are dealing with a child with special needs. You are dealing with a sibling with drug abuse. That can easily affect you emotionally. And of course, not that spiritually, physically, emotionally, financially. And that is one thing that can easily make you break down. This third S is school and work, and this is where you come in. Like I said, 2/3 of your working hours, you spend it in the workplace. So imagine if there is not an enabling environment. Imagine if there's sexual harassment. Imagine if the environment is toxic. I remember there was a time there was a Twitter uproar on toxic working environment. That could easily make you to break down. The second E is environmental factors. There are so many things. For us in Lagos, air we breathe in, there's air pollution, there's noise pollution. You don't put on your generator, your neighbor is putting on his or her generator. There's so much environmental factors that can easily, and government policies that can easily tell you into having a mental illness. And the last D is dealing with the toxic thing or toxic workforce. So whenever you think of that word, I'm stressed, the STRESSED. These are the things I'm talking about that can easily break you down. As I round up in my, talking about the big elephant in the room, what are the way forward? As workers, as managers, as directors, we must have an enabling environment whereby we do not just want to survive, but thrive and flourish. So what do? Help to train your managers on employee as on mental health first aid, training on emotional intelligence, equip them so they can pick up the early signs and symptoms and help people in the environment. Of course, also make sure if you do not have employee assistance program in your organization today, please hear that Dr. May said, it is a must for you to have employee assistance program. This is a service that helps to create safe spaces where your employees can reach out to certified and trained therapists, counselors, psychologists, and you can get the help that you need at the nip of the finger. My organization, Pinnacle Medical Services, we have 23 organizations we are working with now, and over 3 million Nigerians, employees and their family members. And we have a call center where people can call it at any point in time of the day. And if for any reason it is so bad and is severe, have a hospital that you can easily walk in and receive treatment. So for you as an individual, that is for the organization. As an individual, what do you do as I round up in 1 minute? Please prioritize your self-care. Remember, self-care is self-preservation, not selfishness. You cannot give what you do not have, and you cannot operate from a place of deficit. And what is essentially self-care? The S is self-awareness. When you are self-aware, you know your triggers, you know your stressors, you know your weaknesses, you know your strength. That way you can manage your stressors as they come in. E is for exercise. It's not to losing weight. Myself and my sister there, Osayi, we know it's not for losing weight. Exercise will help to boost your feel-good hormones, endorphins, and it helps to reduce stress, anxiety, fear, and manage mild cases of depression. If exercise is packaged as a pill, it will be the world's most sold pill. The L is limit exposure to news and social media. But there are some places now you do not want to go to. There are some TV stations you don't want to switch on because it will affect your mental health. Likewise, some social media platforms, if WhatsApp groups are not, some of them are not serving you, please uninstall. It's your time, it's your money, it's your data. And that will help you prioritize your mental health. The F is find and engage in pleasurable activities. Things that will help you, things that will enable you to thrive and flourish. Find and engage in them. COVID has taught us something, and we should take those lessons that we have learned during COVID. C is connect with a healthy support system. We all deserve to have a support system, but most important, a healthy support system that will clap for you when you are up there and pull you out from that dark hole when you are down there. And because I talked about loneliness is a global health crisis right now. Eggs ask for help. Dear uncles, daddies, and brothers on this forum, please, asking for help is a sign of strength and never a sign of weakness. Don't make it look as if I'm a man, be a man, that is what, no. Please ask for help when you need it. Sorosoke shouldn't die with NSAS period. Please Sorosoke when and if you need it. R is rest and sleep. You deserve rest. You deserve sleep. I know Lagosians have exited this WhatsApp group right now because they are there, we don't sleep, time, energy, no. 7 to 9 hours is what the WHO has said. Please find time to sleep. There's no award for the busiest person on earth. You do not want your body to sleep on you because the moment your body sleeps on you, you will spend all the money that you've ever saved to take care of it. And the last is eat right. Let your plate be rainbow color, not white and red, rice and stew. Make sure it is the fruits and vegetables in the season. And I hope with this 3 point of mine, with the word stress and self-care, you are going away with something very important that you start doing as of today. Thank you.
Dr. Kadiri, Dr. Maymunah, thank you. I mean, anytime I listen to you, I'm always writing things down. I mean, you've spoken so well. And there's so many things that, I mean, I'm trying to catch up. It's just totally amazing. But one of the things you mentioned, I think we'll come to it again when we're having a conversation, is the package madness. When you said it, I was even afraid for myself. I was like, Osayi. And then loneliness is a global health crisis. So you might have people around you, but you're lonely. And of course, we should prioritize self-care. And you explained to us all the different things. One of the things I picked up for myself was rest and sleep. Well done. Thank you, Dr. Kadiri. And I know that we're going to have a lot of questions when we are done with all the speakers. So please just wait and you join us at the end of the day. I'm going to call right now Dr. Leonard Okonkwo. I've given a brief of who Dr. Okonkwo is. And I think he will continue the conversation talking about where we are in terms of our mental health and our human rights. So I'll hand it over to you, Dr. Okonkwo. Thank you. Dr. Leonard, are you here? I think Dr. Leonard, okay, he's just.
Okay. Sorry, I
Over
was
to you,
muted. I didn't.
No problem.
All right, so I was just greeting everyone and saying that all protocols duly observed. Thank you very much, Dr. May, for that wonderful presentation. In fact, I don't even know what to add to it because many of the things I would have wanted to say have been said. And but just for me not to just come and not say anything at all, let me just add a few things to that. And that is to look at the current situation. I really want to talk about the surfing through the storms that is insane in an erratic business world. So I'm just going to add a little bit of some business things here and there, of course, not much as such. And the reality on ground is that the business environment is not stable right now. The business environment is not really encouraging. Let's start with inflation, for example. The National Bureau of Statistics makes us to understand that as at this week, inflation rate is 33.2%. Of course, that is not very good for business. What are some of the things we experience in the business world? Insecurity. When we talk about insecurity, we're talking about terrorism, banditry, kidnapping, those who are agitating for succession, is that what it's called? Secession, actually. And people who want to divide the country. So many things are disturbing the business community. So business is not really looking very well right now. What about the unstable policy? The central bank has come up with so many policies in the past 1 month, in fact, the past 6 months, that sometimes we wonder which one are we really following. So if you are a planner, what do you plan with? How do you plan? So the business environment right now is not looking good. And what about access to credit? You can't do business without money. How easy is it for you to get loans for business? And what about manpower? You develop manpower, and before you know it, the manpower you have developed is gone for greener pastures. Look at the rate at which people are leaving the country for greener pastures. That is the situation that we have in Nigeria right now. And just like Dr. May said, when we relate this to the issue of health, we know that mental health has to do with those major 4 factors that she talked about. Being able to realize your abilities and to cope with stress, work productively, and contribute to your environment. And the reality on ground is that business, the business climate affects our mental health one way or the other. We can't run away from that. And if you look at the determinants of mental health, there are many factors that we work hand in hand in order to determine our mental health. And one of that is the economy. We have culture, we have the community, interpersonal relationship, even the individual too has a role to play in his mental health. But I want to talk about how businesses or the business atmosphere contributes to mental health or to mental illness. And like Dr. May talked about stress. Stress is very, very, you can't remove stress from the equation. She talked also about anxiety, which is one of the most common mental challenges. We have depression and psychosomatic conditions. These things are so very common, but we don't know that they're actually signals to poor mental health. And the fact that more and more people are breaking down with mental health challenges. Let me just talk about them very quickly. Now, when you talk about stress, Dr. Mia has talked about one angle of stress, but I want to talk about how stress actually comes. And stress can be seen from 3 major subtypes: conflict, frustration, and pressure, which are things that you experience in the business world. Conflict has to do when you have 2 or more motives arising that cannot be solved together. You want to do one business, you want to do another business, but what you have cannot help you to do both. It creates a lot of stress. You want to please one person, another person is drawing your attention. Even in the workplace. That is stress. Then frustration is when you have distressing feelings resulting from an inability to change or achieve something. You have goals that you want to achieve. At the beginning of every year, people have goals for the year. Business goals, personal goals. But then you find that the business atmosphere is frustrating. In other words, these policies, these insecurities, these things stand on the way of fulfilling these goals. That, again, is stress. And then pressure. Of course, pressure, we can look at it very loosely and lose the meaning. But pressure is from the Greek word press or pressura, meaning the urgency to complete a work or a work-related task within a specific period to appropriate and acceptable standard, everyone is passing through pressure. You have to do much more in order to achieve what you normally will achieve before. And these things are very, very stressful. The resultant effect of this is that the anxiety level rises. The future, what does the future hold for my business? Like has been said, at least 20% of Nigerian workers are affected by anxiety. And you know anxiety from the signs and symptoms that we see: excessive irrational worrying, poor and disturbed sleep, frequent tiredness, palpitation, dryness in the throat or mouth, even sexual problems. You find that in recent times there have been, an increase of complaints about sexual problems, sexual issues, and sweating. These things are things that you can see and know that, anxiety is in the house. And a lot of these anxieties are generated by the business climate. What about depression? 13 to 15% of Nigerian workers are depressed. And depression is a major disability. It's depriving the business world of income. A depressed person cannot give out his best. And how do you recognize depression? Persistent sadness or weeping spells? You see someone just crying unnecessarily? Well, that's one of the things. And this sadness tends to be persistent, unshaken. And then there's the loss of interest in pleasurable activities. The person might even have problem with his appetite. Again, reduced libido, sexual problems, which again become an issue in most homes that experience this, because the partners start suspecting each other of infidelity. Then reduced energy and concentration, which are key factors needed for productive work. There's poor sleep, and if you're not sleeping well, what does it mean? Your productivity level will reduce. Then guilt feelings, and many more people are thinking of suicide. In a situation where someone takes a loan and is not able to pay back the loan and is going to lose a lot of his collateral, the next thing he starts to wonder, how do I cope after this is done? And then he begins to think of suicide. When his business is collapsing and he doesn't see how else he can survive, he begins to think of suicide. What about other mental health issues that we don't usually look at as mental health issues, like insomnia, difficulty in sleeping, psychosomatic conditions? We have talked about sexual difficulties, migraine and headaches. You take all kinds of Panadol and pain relief, and it's not just helping issues. And increase in high blood pressure or high blood pressure incidents. And then unexplainable tiredness, fatigue, even indigestions. All these things are things that are associated or have increased, but the business climate is implicated in this increase. I just looked up at some statistics and I found out that even though many of us have been talking about 20%, some actually quote 25% of Nigerians having mental illness at any point in their lives. And out of that, 34% only are able to even see a mental health professional. Why is it so? Even though we talk about mental health as a fundamental human right, it's a fundamental human right, but then people cannot access it. There's shortage of mental health professionals. The last time I checked, less than 200 psychiatrists in Nigeria, less than 500 clinical psychologists in Nigeria, and maybe about 1,000 psychiatric nurses. And when you look at the huge number of people that need mental health services, then you ask yourself, how can these people access mental health services? And then apart from that, mental health services are not cheap. And even the infrastructure for mental health treatment is poor. Most of all, the level of stigmatization is still very high. And we're talking about mental health being a fundamental human right. So if we really want to address it, then charity must begin at home, and it must begin with us in the workplace. Some major things that will help us to recognize mental health issues, because most of these things we talk about are things that most people will experience. But then how do you determine which one is a mental health condition? How do you determine which one is a psychopathology? And I always like to look at it from 5 Ds, different angles. 5 Ds that would help us to recognize these things. And the first one is deviance. If you look at the normal curve, you understand that any person whose behavior is at one extreme or the other on the normal curve, then you know that it's a sign that that person might actually be having a mental health condition. What about the distress? If the person is experiencing distress as a result of the issue we're talking about, then the person might actually be having a psychopathology. And if the factor of interest is dysfunctional or is a dysfunctioning factor, like we've talked about depression being a factor in productivity, how so many people are becoming more and more non-productive, then we understand that, yes, there's something we have to deal with. And of course, danger. Does it portray danger? Does it create a dangerous situation? And then duration. It's okay for one to experience one thing and then get over it. Like you might just occasionally feel sad. But then if the sadness becomes persistent and continues over a period of time, then you know that that might be a sign that that is a psychopathology. So 5 Ds that we can use to actually help us understand or recognize when a situation is a psychopathology: deviance, distress, dysfunction, danger, and then the duration. So what can executives do to help in this situation? What can we do as business directors? What can we do as business managers? Well, I just put them together, a few things. Of course, we can't exhaust them. And since we're still going to talk, answer questions, I'll just mention a few. And the first thing I have here is that we should promote mental health awareness. Mental health is still not discussed enough. And many people still don't understand what mental health is. And since they don't understand what mental health is, they don't understand what mental illness is. They still have issues understanding what causes it. Many people still think it's because of the witches in the village. When something happens, they say the person's villagers are at work. It is our duty to help promote mental health in our place of work. And when we do that, it will help to destigmatize mental illness. When people really understand this issue, then the issue of stigmatization will reduce. We should also train managers on simple signs and symptoms of mental illness so that they can recognize these things on time before it becomes a destabilizing force in the workplace. Bullying is one thing, one trigger for mental illness. And of course, we don't talk about it much, but in the workplace is one place where we experience a lot of bullying. At least in the past 1 week or so, or 2 weeks or thereabout, I've had 3 cases of bullying in the workplace. And these things, they actually came up because it's affecting their mental health. We can help promote mental health awareness by also having a zero tolerance for bullying at work. Then let's address stress at the workplace. Stress is one major issue that we have to deal with. at the workplace if we want to control the issue of mental health for workers. Like Dr. May talked about COVID. COVID taught us a lot of things. And one of the things that COVID taught us is that you can work from home, which means you can have flexible work schedules to reduce the level of stress. Most people actually pass through Lagos traffic traffic in order to get to work all the time. Maybe not. Most people travel long distances to come to one room in order to attend a meeting or even an executive meeting at that. Not really. We have technology that can help to reduce the level of stress. Right now, we are having a meeting, we're having a workshop, and everyone is in the comfort of wherever he is. Some at home, some in their office, some might even be in transit and yet still connected to the meeting. So flexibility is one thing that directors can help put in place in the workplace. Then appropriate workload. Some people are overworked. And like I talked about pressure being one source of stress, that also can be a trigger for mental illness. Let's regulate the workload that people carry. Sometimes you have one person doing the work of 10 people. That is not appropriate. And because of time, I will not dwell too much on that. Let's also improve work-life balance. We talk about work. Let's balance it up also.
Yeah.
Employee discount programs will also help. We can help to discount vacations so that our staff can go on vacation. I know of an organization that helps to discount. Is my time up? Okay. So I know of an organization that helps to encourage their staff to go on holidays, take some time off by giving them discount in hotels where they just go, maybe pay 30% of the hotel accommodation. And then that is it. Okay, and then gym services, because we know that gym services help to reduce stress. Then what more can I say? This one cannot be overemphasized. Pay our workers well. Then let's support ourselves. Dr. May has talked about employee assisted program. It is very, very important, and every organization should have it in place. We should build and encourage healthy relationship in the workplace and encourage people to speak up early. I think I will just stop there. Thank you very much.
Thank you so much, Dr. Leonard Okonkwo. I mean, I like that we should help people and people should speak up early. It's one of the issues that we have here where people are actually very quiet and
I'm done.
They don't want to. Oh, thank you, sir. Okay, I can hear you. And they don't want to speak when something is going wrong in their life. So thank you for all that. I really enjoyed it. And the statistics, 20 to 25% mental illness, and only 34% of people see a practitioner. That's a huge issue. And, you know, these things, once they're not captured on time and dealt with, as you mentioned, it even begins to get worse. I like the fact that you also gave us, as, you know, leaders in our workplace, so many things that we could do, how we can promote awareness, how we can train our managers, and the flexibility, work-life balance, employee discount programs. I mean, those are things that we can just take away now with us and say, okay, I can even start these 2 things in my organization. I know he mentioned several. Let me even start 2 or 3. I'm really, this is really amazing. And it's something that I'm so glad that the team and of course, Mr. Okonkwo, and the rest of the team were cognizant of the fact that this is so essential for us to deal with as our first topic. So thank you, Dr. Okonkwo. So I'll move over now to Dr. Abiola Salami, who will be speaking to us as well, and just taking us through a process of his own life and what he's done over the years and enabling him to survive through the terrains of our environment. One of the things that Doctor said earlier was that our environment is making us very anxious. The business climate affects our mental health. And we all know this, even if we avoid it, to talk about it. So over to you, Dr. Salami. Thank you.
Okay, thank you very much. Good afternoon. Let me start by saying thank you to the president, my president, for the insightful welcome speech. And then good afternoon to all governing council members, all IUD members, our anchor. You've been doing a great job so far, Ms. Osayi, Alile, Dr. May, and Dr. Okonkwo, both of them delivered quite insightful thoughts. And then the third doctor is not a mental health doctor, that's myself. I'm not a psychiatrist. I am a business leader who encounters incidences of mental illness, who has been subject to mental health issues, and that is because I'm a human being. And so I started CHAMP some 12 years ago, and the conversation on mental health did not come up until lately. Before then, I worked in 4 thriving industries, and the reality of the marketplace, the reality of disappointment, that can lead to throes of depression, the realities of the culture that pervades in many organizations that is not supportive, of even the goal of the organization as much. You have leaders, who use bullying and brute force, intimidation, passive aggressive style of communication to engage. And while we point fingers, to these leaders, and we expect organizations to do some things to ensure that we help and support every one of us to promote our mental health, it's equally important that every one of us, we know that it is our personal responsibility. As the theme says, your mental health, your human right. Let me add that your mental health, your personal responsibility. And I tell you the story of Mr. and Mrs. M.I. They stay in Lagos. They work on the island. They live on the outskirts of Lagos. And it means by 4 a.m. thereabout, they are both awake. They have 4 children. And they are awake to get their children ready for school while they are also getting ready for work. And they ride in the same vehicle, their house at about 5 a.m. so that they can meet up with the resumption time of 8 a.m. And then they commute. While commuting, different kinds of things happen on the road. There's traffic. There are people driving, in interesting ways that we all know that at a time some of us are guilty on the call. There are interesting ways of driving, and then they want to do, waka, that thing that a lot of Lagosians do. And at times, Mr. M.I. will park and give a piece of his mind to whoever else is driving, that is driving in an unprofessional, unkind way. At times, it could be Mrs. M.I. And so before they get to the office, they are already super stressed. Resumption time, 8 a.m. They're already super stressed. While they're on their way, they are calling the school to make sure that their children are already, that the school bus came to pick them to time and delivered, dropped them at school, before time. While that is happening, still on their way to the office, they are thinking about a conversation that happened last week about the careers of one of them that is threatened. And then they get to work, and the last thing they are ready to do is work, because the move from the time they woke up to the time they got to work, different issues triggering them. All of these things are triggers. Triggers, we don't have control over our triggers. What we have control over is how we respond to the triggers. And for me as well, I understand this, that I can't control the disappointment here and there. Part of what we do in CHAMP We organize different leadership development programs for young people, for women, for senior leaders. And in the course of engaging organizations, some will say, okay, I will sponsor you, and something will come up, and then they can't come through, but the program has to go on, trigger. And so that what will happen? How will this become successful? Will this not flop? We're expecting everybody. We've put billboards in town. We've done this, we've done that. And then the triggers coming, just the same way triggers are for Mr. M.I. And it is important for all of us to know that, yes, we can't control what is triggering the stress. We cannot control the stressor, but in many ways, we can control our response to the stressor. And the reason we've not been able to as much control our responses to the stressor goes back to a lot of things in our background that can be resolved even right now. So elementary biology says to us that irritability, that once there is stimulus, there is a response. When there is a stressor, then immediately we cave in. But further studies in psychology has oriented us that between stimulus and response, we have the power to choose our responses. The challenge we have is that the power to choose our responses is being waned by the kind of content we consume, the kind of things we watch on social media, the kind of conversations we have with our friends. So one of the things I have consciously done is to ensure that I sift the content I consume on social media, because I believe that none of us is smart. We are all as smart as the influences we subject ourselves to. And for us to have sound mental health, it is important we control the gates into our minds, our eye gates, our ear gates, that we sift the things that we consume. Not just the things that we consume, the things that we contribute to as well on social media. Every one of us know that on social media, when there is a bash, there is always a boost. And I hope that is not just a statement for millennials and for Gen Zs, that every one of us on those platforms, we know what is obtainable there. There are times nobody has asked for our opinion, but we just want to share on social media just to show, that we are there. And for some of us, it's a way of coping with isolation. So you're using a problem, to solve a problem, and that becomes a bigger problem. So it's important that we sift the things that we consume on social media and the kind of conversations we contribute to, as well. I have consciously done that. Another thing I have consciously done, with a group of my friends is the kind of conversations we have. We don't have conversations that would depress us. In as much as there are three of us very close friends, we're all entrepreneurs. We face humongous challenges, especially there's a song, if your father is not Dangote or Adeleke, but you want to be okay. You may know the phrase of that song, which is based on your background, you're not that privileged, but you're trying to thrive through, and which is what the three of us have been doing. But in as much as we know that we don't have that privileged background, we are creating the privilege for ourselves and for our children. And the kind of conversations that we have is not depressing, it's supportive. So it's important to have, that support structure. Support structure, not of friends, who are envious of your success, not of friends who will gossip you, but friends who are supportive. That support structure is critical, it's very important. And in all of this, one of the things I see in the marketplace is how mental health has also become an excuse to performance. And that is largely, amongst Gen Zs. So you expect somebody to deliver a project at a point in time, and then they are not delivering the project. And their excuse to you is because of my mental health. Now, we are not saying that mental health is not a reality. We are saying it's important we put it in the proper perspective. And Dr. May did an excellent job of defining, mental health for us already. Now, put it in the proper perspective. Yes, we put the spotlight on it, but we also pay attention not to overcompensate for it. Because many times when an issue has not been sufficiently discussed in our society, what we do is we overcompensate for it, whereas leaving other areas, that is also of great importance. So that's one of the things I try, to do myself with my team, and our other stakeholders to ensure that mental health, yes, it's an issue. We ensure that we put the right structure in place to support ourselves, to support our loved ones, and also ensuring that we don't overcompensate, because overcompensation is actually creating another level of problem. So these things are critical. And in the workplace, for every leader here, it is important that we do our best to create a culture of peak performance within our organizations. Because the way our work culture even further triggers and further degenerates our mental state, is alarming. And I understand that for some of us leaders, the kind of leadership we received is the exact kind of leadership we're dispensing, which we need to watch out for. Now, while we're receiving that kind of leadership growing up in the corporate world, we detested that kind of leadership. We hoped for a better kind of leadership. We detested coercion. We detested aggression and aggressiveness. We detested anybody talking down on us, looking down on us. But now we're in leadership positions, and the exact thing we condemned 2 decades ago, 3 decades ago, is the exactly we're replicating. Because all we did was condemn it. We did not seek intervention to help us not to become what we condemned, right? So, and then there are times some of us will say, oh, I have paid my dues. And what we really mean about paying our dues is not delivering excellent performance. What we really mean by paying our dues is not because we've improved on our skills. What we mean by paying our dues is that they dealt with me yesterday, and I'm waiting for the person I will deal with, tomorrow. And I give you an example. While I was, before I started Champ as an entrepreneur, one of the places I'd worked before, I remember one of my bosses, was quite aggressive. I mean, really aggressive, really unsupportive, and after a while, I won his confidence that I could do an excellent job. And after winning his confidence, we became, he became a bit more approachable. And I asked him, one of the days that, what's up? Why do you treat me, like this? Why do you bully me? Why are you this aggressive? Because I felt it's unnecessary, because I'm getting work done. I'm doing excellent work. That conversation with him because of the relationship I have now consciously built with him. And here's what he confessed to me. He said to me that he has been waiting for me to resume work. Not me in person, but anybody that is junior to him to resume work. That because the kind of aggression, the kind of bullying he experienced, he's been looking for who to drop it on. And so the moment he saw me resume day one, he was so excited that yes, the person that will reap all the bullying that is experienced by his own bosses has resumed. And he served me that pressed down, shaking together, running over. But here's the decision I made when he said that to me. I didn't mention this decision to him. It's just a decision I made personally. I said to myself that I have now learned how never to lead anybody. I've now learned how not to be a leader, because many times it is easy for us to just push, to just advance what we receive. We receive toxic behavior, we receive toxic leadership, and then we just advance. This affects our mental health in many ways. So if we're talking about finding ways, around ensuring that we have sound mental, I will add emotional health, I would say sound mental and emotional health. It is important that for every one of us, we remain supportive of our team members, every one of us, and we also find ways to help us to cope. And one last thing, one of the ways I cope as well is spending time on the piano. Spending time on the piano. If you probably follow me on social media, so you see from time to time I post my piano sessions. That is my zone, a place of peace and ease for me. And every one of us, we can find something. Not indulging in drugs, not indulging, in some other things that may make the problem worse. I hope I've shared a few insights, and I look forward to the question and answer session. Thank you very much.
Fantastic. Thank you so much, Dr. Abiola Salami. You know, I like the fact that you say you have to find your own zone and that we must take responsibility for our health, your personal responsibility, and that we need to be intentional about our mental health. And I'm really looking forward to the questions. I'm asking people, please, can you write your questions in the chat box, and so we can take a few questions. I think you say, how do you respond to your triggers? Since you cannot actually control the stressors, but what's important is how you respond. And we have to find different ways of responding. I mean, all the three speakers, Dr. Salami, Dr. Okonkwo, and Dr. Maymunah have connected all the dots, taking us through a journey of what mental illness is, what mental health is, and what are the stressors that come and relate. We talked about the environment, we talked about the economics, since we're all leaders here, and then also coming up with solutions in dealing with this and dealing with the triggers and dealing with the stressors that come with it. So we're going to have a few questions. I have a few people that have written some things out here, and I'll ask those questions first, and then we can take more questions as we move along. Thank you, everyone. It's been an amazing session. Thanks to the three speakers. There's a question here that says, and this is for Dr. Kadiri. He said, can you expatiate on self-awareness in relation to stressors on mental health? And I mean, in terms of how do we deal, what's self-awareness and how do we relate it to the stressors in terms of mental health?
Thank you very much for that question. Yes, self-awareness is a big part of what we call emotional intelligence. And at this point in 2024, we shouldn't see emotional intelligence as part of life. It is life itself. Because when you are self-aware, it helps you to be able to deal with your stressors, your triggers, and you can manage yourself appropriately, and that will help you to manage other people. So self-awareness in the context of mental health and stressors is crucial to understanding how external factors, right, affect our mental state. Because when we are self-aware, we recognize our emotions, our thoughts, our reaction, and even the behavior, enabling us to identify our stressors more effectively. That is what self-awareness is. So imagine if I ask us on this forum now, who are you? That's a question I want you to take away. Most of us will say what we are, not really who we are. Dr. Maymunah Yusuf Kadiri, I'm a psychiatrist in chief at Pinnacle Medical Services. That is what you are, not who are you. Self-awareness retrospectively makes you understand who really you are, your strengths, your weaknesses, your triggers, your stressors. And so by doing that, by understanding your self-awareness, knowing your triggers, knowing your stressors, whether it's work pressure, whether it's relationship issue that's causing it, whether it's financial concern, we can develop good coping strategies to manage them better. And additionally, self-awareness allows us to recognize early signs of distress, empowering us to seek support and implement self-care practices before the stress will escalate into more severe mental health issues like anxiety or depression. Like I said earlier, mental health is a continuum from the healthy to the extreme of being unhealthy. So it's important for us overall that cultivating self-awareness fosters resilience and promote overall well-being in the face of stressors and adversities.
This is really, I like the fact that you took us back to emotional intelligence and how we as leaders must be emotionally intelligent in dealing, because I mean, we know that when you get to a place of leadership, you're not only dealing with yourself, you're dealing with all the other people that you're working with. And if you don't have any emotional intelligence, if you don't know what's going on, if you cannot see, if you cannot even control and balance your life, then you already have a problem. And then you create more problems for the environment that you're working with. So emotional intelligence is key. I mean, let me go to Dr. Leonard Okonkwo. There's another question here. And Dr. Leonard, okay. Are there ways of eradicating or coping with anxiety disorders? I know you mentioned a few things when you were speaking, but they're asking now, what are the ways of eradicating, totally removing it or coping with anxiety disorders?
Oh, well, you are specific in saying eradicating anxiety disorders. But let me just quickly say that, just for the records, that anxiety is normal to a particular level because it helps us to up our games, helps to bring out the best in us when it comes to a particular level. If you're not anxious about the results you are going to get in an exam, you probably will not prepare. And then because you don't prepare, you will not come out excellent. However, since we're talking about the disorder, yeah, this there are some things we can do to manage it. To manage it. And that is the first one I can talk about is that, when we learn, to interpret things rationally, it will reduce the level of anxiety. There's a great philosopher who said that people are not disturbed by the things that happen. They are disturbed by their views of those things. So perception plays a very big role, even in anxiety cases. The way you perceive something helps you to, determines how you feel about it. And the way you feel about it will also determine what you do about it. Learning, to see things rationally. We talk about cognitive restructuring. If you can teach yourself how to see things rationally, then the anxiety level will drop. And then when anxiety level drops, you are having less of anxiety disorders. But there are times also, because that can take a long process, there are times also when you have to adopt some certain learning to be calm, knowing that anxiety itself is propelled by the sympathetic nervous system, and learning to use the parasympathetic nervous system to suppress or to neutralize the effect of the sympathetic nervous system also helps. You learn to relax because, like someone said, you can't be anxious and relax at the same time. And you can teach yourself to relax. Like a relaxation training, the breathing exercise, some of these things I talked about, the gym, vacation, all these things help, all right, to neutralize the effect of the sympathetic nervous system that tend to raise the anxiety level, right? So are some of the things we can do. Well, there are some medication that help also. Some medication can help also. So I would rather talk about management. We can manage anxiety well, not eradicate it.
Eradicating it. Wow. So, I like the fact that there are different techniques. Of course, everyone is different. We're all busy. Everyone that is on this call today, we're very, very busy. And our audience, this is who we are. And, also the environment that we live in, as I think Dr. Coco had mentioned, is an anxiety environment anyway. There's always something to be anxious with. Everything might be going smoothly in 1 second. Everything just goes berserk in the next second. But if Dr. Salami, before I come to you, Dr. Coco, someone had asked that you please write out the 5 Ds in monitoring mental health. If you can just put it down in the chat group, we'll be very happy to take it away with us. We'll be very grateful.
Okay.
Thank you.
I will do that.
Thank you so much, sir. So I'll go back to Dr. Salami. I know every one of us has said a few practical tips. Can you so maybe let's look at it in our office place now, for example. So I'm in the office now. I'm the CEO running an SME organization. If you can just give me 3 practical tips that can help in the workplace with my team, that can help at least to a certain point stabilize when I see these triggers coming in. Because I know that Dr. Kadiri mentioned that we should teach our people to see the triggers. But if the triggers, if HR comes in and comes up to me and says, I can see that these people are stressed, can you just give me like 3 tips that I can use that can help to at least balance it out a bit before we even begin to think of who can come in? Can we call Dr. Kadiri or Dr. Coco to come and talk to our staff? So what will you use as an entrepreneur?
Okay, so I will be doing everyone on this call a disservice if I don't say something first, because emotional intelligence has come up in this conversation, right? And that is one of my areas of focus. So I'm posting a link into the chat box, where members can obtain a free chapter of a book, of their choice, free chapter depending on what applies to them, how to manage depression, how to manage anxiety, a number of them. So we can choose from that. It's free. So to the question of what are the things that the CEO can do just immediately? One of the things, when it is your own, and the other one is for you to manage your team. When it's your own, self-awareness, one, understanding your triggers. But when these triggers happen, one of the things you can do is to be silent, right? And by silence, we don't mean keep your mouth shut forever. What we're saying is that at that moment where somebody has said something or some situation has triggered you, you want to ensure that you now bring the second thing on emotional intelligence, which is self-management, to ensure that you don't immediately voice an opinion or say something the way you felt it almost immediately. Because many times when we don't pause, the next thing that comes out of the mouth of the leader may not be something productive. So, for example, we've given an assignment to someone you expect to be competent to deliver on a project. And the feedback you've received is the person has just cost you a humongous loss. The most likely thing that may come out of the mouth of a CEO from that moment will be an insult, and you will be right to have insulted someone that you expect to have, to have some level of competence. You would be right. But the fact that you are right, is that the most effective way to deal with it? No. So you want to pause. One of our recommendations is to manage yourself in those situations when you are triggered. Pause for 10 seconds. When you pause for 10 seconds, one, a number of things will happen. One is that the immediate subconscious statement that could have come out, that could have destroyed the entire conversation, that could have run down the esteem of the team member, you will likely not bring that out in your first when you pause for 10 seconds. The other thing is that when you pause for 10 seconds, you're able to think, because what happens is when we are in throes of these issues, our rational mind, our rational brain is suspended, and then our emotions take over. But when we pause for a few moments, we're able to take charge of our emotions so that whatever the CEO would say will be something productive to advance the project. Now, when HR comes to you and says that, oh, I'm noticing the number of triggers,
So Salami, you are going in and out. I don't know if it's only me. The network is okay. Can you continue? Let's see if we can hear.
Oh, okay. So one of the things you can do as CEO is bring everyone together to have a conversation. Because one of the reasons we find ourselves in this throes of mental health is isolation. And let us not take isolation as not being with people. No, isolation, you can actually be with people and you are actually not with them. There's a phrase of a song that says, I was downtown in a rush crowd, but I still feel all alone. So you can be in a crowd and still feel isolated. You can be around people and still be isolated. Isolation is not just a sociological thing, it is also a psychological thing. If it is just a sociological thing, then you're talking about you being with people. But because it's a psychological thing, it's about you yourself. But when you engage your team members to have conversations, helpful conversations, about how they're feeling, what they're going through, it really helps. Those are part of the things that the CEO, can do. One, to manage himself or herself. Two, to help manage, almost immediately.
Fantastic, Dr. Salami. Thank you so much. Thank you. I like that pause for 10 seconds. And I like the correlation you've done between isolation and loneliness, which is what quite a few people have spoken about already, and so things that we must begin or continuously think about. Dr. Maymunah, I'll come to you. Dr. Salami, you have another question, but I'll go to Dr. Maymunah and then come back to you. You know, in the society we live in today, I mean, even from the kind of questions we're getting on this platform, people are just we don't want to really still talk about these things, and it's just an issue of fear, sometimes stigmatization. I mean, if someone has found that you have a mental illness in the office and you come back after 3 months, how do people see you? And how can we encourage more open conversations about this as leaders or as people that are managing teams? And that's the first one. And then the second one is that one of the other questions I was thinking about is that, you know, there are going to be trends that, I mean, I'm sure there are trends that you've seen as you've studied mental illness and mental health in the workplace. What are those emerging trends or challenges we can anticipate regarding this issue in the workplace, and so that we also begin to prepare our minds for them going forward? Thank you.
Thank you so much. Those are very brilliant questions, I must say. And, you know, during the COVID era, right, there was a whole lot that happened to us. There was a shift. Aside from mindset shift of us talking more about our mental health now, because it's a journey, it's a work in progress. Do we want people to talk more about their mental health? Yes. But do we also want people to talk about their mental health in ways that is not seeking attention? No, everything. Gen Zs and Alpha generation. It's my mental health. It's my mental health. And I find that it's not aligned those that truly need the mental health services get it, because everybody's just associating your zodiac sign and my mental health and trying to, you know, invade productivity and do their work, right? But again, what are those things? Like in a workplace that can easily, you know, we can create that enabling environment where the employees, because even the employer of that organization is an employee at the end of the day, because it's one person we are focused on, is a customer. If there's no customer, then that means that, you know, work done zero. So what can people, how can the employer, you know, help the employees in achieving and ensuring that mental health, we talk about it just the way we talk about malaria, just the way we talk about our physical health. You see that word S. When people talk about hypertension, people are saying, sorry. Have you seen your cardiologist? Have you seen your doctor? Have you taken your medication? Then it's different from when you now say, oh, I have depression. Why we sympathize with those with hypertension is the word S, sympathy. We stigmatize those that talk about depression. Why? And I need to let everybody know that hypertension, diabetes, mental health, cancer, they are all under non-communicable diseases. So please, let's stop focusing on hypertension, diabetes, cancer, and ruling out mental illnesses. They are all under what we call, they are not going to have it because you have infection, whether bacterial, virus, or fungal infection. No, they are non-communicable. It's not infectious. You can have it if there's a positive family history of mental illness. But there are so many things I talked about at the beginning, what will predispose you and what will precipitate you. So in the workplace, we have to encourage employers to make sure that they encourage an enabling environment where people can speak up, where people can speak out, where people can even encourage help-seeking behavior. So when somebody's talking about, I feel depressed, we are not stigmatizing that person, I'm shutting the person out. And this culture of silence, you cancel people out or make them feel as if they are seeking attention or overreacting or trying to invade work. So let's create that enabling environment, and that onus lies on the employer and owners of that organization. Create that enabling environment where we normalize, mental health conversations. Then, of course, the second part of it is that ensuring that they provide resources for stress management. Who said we cannot take out a mental health day? We have organizations, we are working on that employee assistance program now, whereby they have a mental wellness day. What do? We sip and paint, we do karaoke, they just have fun. That day, it's not going to take anything away, but it's just promoting that environment. Then, of course, encourage self-care tips amongst them and all that. The second part of the question you asked, I think I've forgotten about what you asked again.
About trends and the trends.
The trend, yes. So it's not going to go away anytime soon. The highest burden of disability globally now is depression. And we need to understand that clinical depression, yes, is what we physicians and for us as psychiatrists we diagnose, but there's smiling depression. It's not a diagnosis, but there's smiling depression where the person is the life of the party, very productive, peak performance is boosted in the workplace, is helping everybody to do what they are supposed to do. Then you wake up the following morning and you hear that the person has died of suicide. And you're wondering what exactly happened overnight. What exactly happened that this person took his life when everything was going on well. Let's not forget Robbie Williams was a comedian before he took his life. Let's not forget Kate Spade was in Forbes 500. She was doing so well when she took her life. Let's not forget Anthony Burden, the chef. There's so many, even here, DJ Twitch. There are so many people here in Nigeria that have taken their life. You're wondering what really happened. So those trends we should look out for: anxiety, depression, and substance abuse. And how do substance abuse come into this trend? When people are anxious and depressed, they are looking for ways to take care of themselves. And that is where they start looking for those pills like Valium, Lexotan, they are taking it. Please, if you are in that category of taking Valium and Lexotan to make you sleep, disease from it right now. Stop taking it. They are not medications that you can take for long. They are highly, highly, highly addictive. So please, there are ways we can manage sleep disorders, not necessarily taking Valium and diazepam. They are addictive. So drug abuse is when you now start seeing somebody taking those medications, taking those substances just to take care of themselves, their sleep pattern, their anxiety, their depression. Before you know what's happening, they start increasing the doses, they start increasing the, and becomes an addiction. Addiction is never an event, it is a process. And I must let you know now, as Nigerians on this forum, we are all at risk of having a mental illness. Even though WHO hasn't categorically accepted that, understand the end in Nigeria, it's Naira devaluation. How much is dollar to Naira? We know we had 1,900 Naira to a dollar. It was mad, right? Yeah. So Naira devaluation, I is insecurity, banditry, and kidnapping. G is government policies that are not in tandem with our reality. E is electricity challenges. I don't know how many of us have 24 hours to light in our home. R is road network. Osayi, can you drive from Lagos to Benin by road? Answer that question. Poor road network. You know, R, then I is inflation. Your 100,000 is behaving like 10,000 naira these days. You take money to the supermarket, you want somebody to steal your money. Nobody stole your money. It's your money that couldn't buy what you serve to buy. And overall, the A, the last of the Nigeria, is anger. There's anger in the land. Good money, Osayi. What's good about the money? So that's when you see when you go to the workplace, they're waiting for good money. They are angry. They are not necessarily angry with you. They are angry with everything that's around. So as a Nigerian, you are at risk of having a mental illness. So please start to prioritize your mental illness. When they say, Dr. you are mad, say you are right. Stop arguing with people anyhow. You are right. And when you know you are not stupid, you are not stupid. So stop arguing before you affect your mental health. So prioritize it.
Dr. May, goodness gracious. I'm just even wondering to myself, you know, you're trying to pull all these things and think, oh gosh, how do I balance my life out? I don't want to get to this point. I mean, but everything you have said, you know, is, and every one of you have said, is just like triggering so much that we are dealing with as Nigerians are dealing with. And we just have to be, as you said, be very conscious about it. We have to understand it so that we don't get to a point. And I was a bit worried when you mentioned addiction is a process, because I hear a lot of mothers say, oh, I just take something to sleep every night. And so it's something that I've never actually thought about as one of the issues that we are dealing with. But a lot of even executives do take something to sleep every night because they're tired. They need to have the 6 hours. So they get used to doing it. So it's a process and it's addiction, regardless of how we say it. Wow.
Process and it's addiction. So it's better for us to achieve what we call good sleep hygiene. Just the way we started noticing that there's good hand hygiene during COVID, there are also processes and strategies on achieving good sleep hygiene. You do not need Lexotan or Valium for too long. If a doctor has written it for you and he said 5 days, after 5 days, stop. Don't go and be passing back door to start buying it, because your 1.5 milligram of Lexotan this week, in 2 weeks time, you move to 3 milligram. In a month time, move to 4.5. In 2 months time, it'll be 6 milligram. And before you know what's happening, you are addicted, and you need rehabilitation for you to get out of any addiction.
Dr. Maymunah, thank you. Thank you so much for that. And I'm really enjoying this conversation, not because it's just something that we all have to deal with and just face on, so that we don't get to a place where it becomes something that is unbearable and we will not be able to manage. Dr. Salami, I'll come back to you. When Dr. Maymunah was speaking, she mentioned a few things, and someone has asked, Mr. Jerry asked a question saying that, please, how can we manage the sense of entitlement in the workplace? I know we need to be conscious of this fact that things are occurring. We have to be, emotionally intelligent in dealing with people, but how do we measure? And I think we said a few things, but how do we measure it? How do we manage, the sense of entitlement when people now begin to use mental illness to even, avoid their responsibilities in the workplace?
Okay, is that a question for me?
It was asked to you, Dr. Salami.
Oh, okay. That's a great question. It is about leaders having the courage to have engagement with our staff, and especially the demographic we're talking about, the younger staff. And what I've seen in the course of my work, I'm coaching some senior executives. I've had executives that will say to me, in these days of social media, I don't want anybody to post what I say to them, on social media. And then you now have leaders that are losing courage to engage. Now, don't engage aggressively. We're not saying you engage with arrogance. We're not saying you engage with toxicity, right? That is not what you should do. But what you should do is engage with assertiveness. So there are 3 things to look at: aggressive, assertive, passive. Many leaders were raised to be aggressive because they received aggressive kind of leadership. And so, because they don't want to be quoted because of their aggression, then they go 180 degrees to being passive. So now you are not even addressing the issue, at all. Or passive aggressive, which is you're saying things that you don't mean. You're saying things because you think you're working on eggshells. So what we should do as leaders is to be assertive, right? So there should be, we have our performance, we have our KPIs, what is expected of people to do. If somebody has come up to me with an excuse of mental health for not delivering on a job, the right thing for the leader to do is you engage the person, you ask a few questions, and then you should have in your organization, and we helped one of the big 4 consulting firms to do this, you should have in your organization an employee assistant, program, that you can refer someone like that to. And you refer to the person in that program, and there is a competent medical practitioner that can diagnose the mental health issue. And then if they found something, they can make appropriate recommendation. And I give you this example. There was this young fellow who had approached his boss that he couldn't deliver on something due to mental health issues. Because of our engagement with this organization, the boss referred the person to the clinic to go see, a doctor. The following day, this young folk came back and said he's now better. He doesn't think he needs to see a doctor. And what we found out is that it was just an excuse. There was nothing wrong with him, but because the boss was not in a place to diagnose whether there's a problem or not, and the boss also took time assertively to engage the person, and then the boss referred to a competent medical practitioner that will give the person an intervention, the individual realized that his lie will be found out, and because of that, he changed the following day. So it's important that we have the courage to engage. And it's important that we have structures in place within our organization. Some of us will have HMOs. A lot of us will have HMOs. You know, we can leverage that. Just make a recommendation. If your team member says there's a mental health issue, recommend the person to go see a doctor. Let them come with a report of what exactly is wrong, and we can deal with it from that. Because when there is no fact to hold on to, emotions take place, and people use that to have their way.
Thank you so much, Dr. Salami, for that answer. I want to go to Dr. Okonkwo. Are there specific resources, either hotlines, programs? I know Dr. Maymunah, I will ask Dr. Maymunah the same question, and I think she's going to put some things for us, that both the employers or the employees can leverage to access support in the environment that we live in. We know that across the world, you know, sometimes if they're having issues like this, there are numbers people can call. Even when you're watching TV, you can see some numbers screening. Say if you're going through depression, you can call this number for someone to talk to. And what can you know, the environment in terms of the different bodies do to help the situation and that we're seeing, especially like, I mean, of course, M.CIoD has done this today, so that's pushing the conversation out there. But do you have anything that they can do different, or is there anything that they can also add to this that can make the body of the M.CIoD even more robust than what it is right now in terms of mental health? Yes.
Well, let me say that there are resource centers online. I don't have them with me now, but there are, and I believe that just searching on Google, you'll find some of them that are helpful. I know there is a helpline for suicide, and then those who have challenges. Yeah, we have that. The ones that I am more familiar with are specific to those, I mean, to staff and students of LASUT and LASUCOM, which will not be applicable here, but I'm sure that there are resource centers that will do that conveniently. Then, what should we be doing? Yeah, it's a collective responsibility. All hands have to be on deck. It's not something that one person will do. And because we have to change our orientation, change the way we see things generally. You know, there's this concept of anomie where we emphasize, you know, success, but we don't emphasize the right way to achieve success. You find, so I read something day before yesterday or yesterday, was it yesterday, that a parent was arrested with his son because the parent went to write JAMB for his son in Nigeria. So the orientation has to be, we have to change our way of thinking. We have to change our way of thinking that we don't all have to be medical doctors or lawyers or professors. We have footballers that are successful. We have musicians that are very successful. We have artists. We don't all have to go to university. And then when you burden people with that expectation, you have to succeed, that is another stress on its own. Every December, well, just before December, crime rate will increase. Why? Because people have to spend money in December. And those who don't have money to spend in December, because financial factors also contribute significantly to being triggers for mental illness. When there is financial stress, that can be a trigger also. And when you emphasize so much the need to succeed, but you don't emphasize the appropriate way to achieve that, that creates some problems also. So it's all around. Everyone must work. Teachers work in the school. Parents work at home. Organizations bring out acceptable principles and practice in the workplace that will help, you know, to create a good business environment and so on. So I think it's something that everyone must work on. Talking about substance abuse, for example, it's everywhere. In a home where the mother is abusing alcohol and the father is taking weed or coke, what do you expect of the children? Definitely you find that. But, you know, if parents work, you don't just come out and say, let's eradicate substance abuse among our youth. You can't just say that. Or in the workplace, it starts somewhere. So everywhere and everyone must be involved in this issue of mental health.
Thank you so much, Dr. Koko. I like that it's a collective responsibility. It's just not really for one person. We all have to, really all hands on deck to see how we can find a way to manage the situation. And of course, when we know that when we are dealing with mental, you know, almost an imbalance, you find out that the office suffers, the organization suffers, even your team members suffer. You go home, everyone around you is a 360 thing. Dr. Maymunah, I'll say ask you the same question in terms of, are there resources out there that I know you're posting a few things here, and Abiola has posted as well. But are there resources out there are there numbers we can call? Are there, you know, and then have some form of, you know, just let me talk to people without anybody knowing who is out there? Who is out there that can help us?
Yeah, and that is very important because not everybody can afford to pay for mental health services. And then again, when we talk about our health insurance, we haven't still captured up to 10% of Nigerians. And this is terrible because we still have over 70% of Nigerians paying out of the pocket. You will find out that people will come for healthcare and they're telling them you do not fall under this category. Or for us in mental health, it's even absurd. Somebody has what we call paranoid schizophrenia. The HMO said they can only admit for 5 days. And this person will need admission for like 2 weeks or 1 month. That means the remaining 20-something days, the person is doing out-of-pocket payment. So of what use was the health insurance? I'm a strong advocate for health insurance because at any point in time, your health can just, you know, just go gaga. But, you know, and you don't have to pay money. So health insurance is one thing I really advocate for. So what are those resources out there? Government can't do it alone. Let's even clear that out. And we are looking at that the government has made our mental health a priority. So before the last administration signed out, they passed the mental health bill into a mental health law, which is good. But we all have very beautiful laws in Nigeria. That, trust me, Nigeria has some of the most beautiful laws in the world. Our problem has always remained implementation and execution. So yes, we have the law now. Implementation and execution is where we are now, where we are having frameworks, policy frameworks. We have national mental health framework and policies now that we have to ensure that every state has a mental health desk and ensuring that our primary health care centers have, you know, mental health imbibed, inculcated into primary health care centers, which there are over 30,000 nationwide. Most of the times when you think about primary health care centers, you're talking about buildings that are dilapidated, dogs and sheep and goats are sleeping there, and that is not supposed to be. So we want primary health care centers that are functional, because that is where most of us are supposed to go to, not Yaba, not LUT, not UCH, not UNIBEN, not UBTH. We are supposed to go to the primary health care centers, right? So those resources that are available online, we have NGOs that have been doing well, and we must give kudos to them. We have NGOs, we have Pinnacle Medical Speakers Initiative, we have Mentally Aware Nigeria, we have She Writes Woman, we have so many of them that are there. So please search out for them, reach out for them. For us in Pinnacle Medical Speakers Initiative, 0800 Speak Up is our helpline, which is toll free. We have people that could call that line from time to time and all that.
So, can you say that? Can you say the line again, please, so we can write it down?
0800 Speak Out.
Speak out, okay.
So let's speak out. And as of last year, we have developed a telemedicine platform. What drove us into that? Two major things. The Japa syndrome. We cannot tell people to stay back in Nigeria. It's in their pursuit of happiness. And the law also do not support that, right? They can go. While they will Japa that into delivering culturally appropriate therapy for Nigerians and the diaspora. So How Body, which is the Nigerian platform, How Are You, is the name of our telemedicine platform. It has a website. I'm going to put it there. It's on Google Play Store and it's on Apple Store. Even if you do not want to seek for mental health care, please go there. We have over 15 free assessments on sleep, on anxiety, on depression, on substance abuse, on anger, on so many free assessments. And it will deliver your response immediately. It will give you your answers immediately. I don't know if I think I have issues right now with my network. So let me just turn into this one. Am I good? Yeah, so exactly. So there are free assessments that will deliver you instant result right away. And you can take that to the bank. If they are bankable, they are being, well atomized and well framed to suit you as an individual. And if you then now want to do therapy, you are just a tap away. Tap, book a therapy session or schedule a therapy session, and one of our therapists will reach out to you and deliver that culturally appropriate therapy to you at any place you are in the world. And it's far cheaper. It's far cheaper than when you walk into our services. So those are some of the services that are available, that you can access at any point in time. So what do we do as a society? Dr. Okonkwo has said it. It is not me, you, it is a collective thing. We need all hands on deck to walk the talk when it comes to mental health. People will come out and talk about, oh, I have depression, I have cancer, we go for me. We need ambassadors. We need celebrities that can share their vulnerability and let Nigerians identify with the fact that if this big musician with 20 million followers can deal with mental health issues, that means I'm not indebted. Nobody, absolutely nobody at this point in time, including myself as a psychiatrist, has immunity to mental illnesses. You can break down at any point in time because you are human. Blood flows through your vein. So while at that, we must promote education and awareness. Chartered Institute of Directors, this is one thing. Many people will not even believe that people are talking about mental health. So this is a very brilliant way of advocating and talking about mental health. And of course, public enlightenment, that is a good way. Destigmatizing mental health, let's just create that enabling environment where we can create safe spaces that people can speak up and speak out without stigmatizing them, without canceling them out, and without making them trivializing their issues, and encourage that help-seeking behavior is very important. Then, of course, the government has a major role to play. Like I said, we have the policy now, its implementation and execution that we need. Yes, again, healthcare financing comes into play. Osayi, this is where ACT is doing so well, supporting organizations with grants and all that. Yes, we understand that Abuja Declaration of 2001 said 50% of our budget should go into health. We have never reached 10%. Never in Nigeria. So healthcare financing is a very good way to also ensure that these policies that we are making, which that needs implementation and execution, need cash backup to ensure that is happening. Then let's take it back to our families, our homes. Let's create good home climate, good home environment where our children can speak to us, where we can talk freely, normalize this discussion, where we wouldn't, be hostile towards our relatives dealing with mental health issues. Let us not be emotionally over-involved with the challenges they are doing. Let us create that good home climate. That is why when a child is being bullied, they will come home and tell you. Because when they tell you, you will shout and say, do you have two heads? Go and be the person back. No, let's create that good home climate, good home environment where our children will not only survive, but they can also thrive and flourish.
Fantastic. Thank you so much. I'm just kind of totally overwhelmed with all the information that has been pulled out here, and looking forward to us taking this conversation to the next level and in terms of implementing. And the truth about it, Dr. Kadiri, is that no matter how small you start off within your organization, at least you are beginning to do something. And I like the fact that Mr. Okonkwo and the team and M.CIoD have realized that let us start something. It's better for us to do something than to stay quiet. And we're speaking out, we're speaking up, and we're talking about these things. So thank you so much to our speakers. We are rounding up. As I mentioned, and I asked a few, thank you for those that have also asked a few questions. I know that sometimes we have these things and people are not able to ask, but the speakers have actually put their information in the chat for you to reach out to them. And if you do have other questions or how best they can help you to create some sanity in the organization and vulnerability in the organization, they will be very willing to help. So thank you. It's a collective responsibility. We cannot do this on our own. And that's why I'm so glad that we have the team here working with us. So I'm going to go, thank you to my panel, Dr. Kadiri, to Dr. Okonkwo, and of course, Dr. Salami. Thank you so much. We're very, very happy to have had you with us. I'm going to hand it back to Mr. Sunday, the Director of Academy of M.CIoD, as we step down from this. We've had an amazing, amazing morning and into the afternoon, and I'm hoping that we'll move to the next level from here. Thank you so much.
Thank you.
Thank you.
Thank you so very, very much, Madam. I want to seize the opportunity to appreciate everybody who has been on this call. It's been an amazing day. Honestly, I've never had it this way. This is one area where personally I've not even learned much, and I've been richly endowed today with the awesome knowledge in the house. Thank you so very much. Well, my duty at this point is to give the vote of thanks, and permit me to start with our president, that is the president and chairman of the Governing Council of the Chartered Institute of Directors, Nigeria. I want to say a big thank you to you, sir. I know his itinerary, and for him to have been able to join this call, it should be that, you know, he has placed this as a serious priority. And so I want to say a big thank you to you, sir. Thank you very much. Let me, on behalf of all of us in the house, you know, thank so profoundly the chairman of the Health and Social Security Committee of the Institute, in the person of Mr. Nnamdi Okafor, FIOD. Sir, thank you so very much. There is no doubt that the Institute has made the right choice in appointing you into this position. You have always been a performer that all of us are, you know, proud of. As one of the shining lights of the Institute, we want to say a big thank you to you. What you have assembled here today is something that will be a point of reference for a very long time to come. Thank you so very much. Thank you, sir.
Thank you.
I cannot thank enough the wonderful panelists that you know, have come to share their wealth of experience with us today. Let me just start from my very good friend, Dr. Abiola Salami, M.CIoD. Dr. Salami has been of immense benefit to us, you know, in the Institute, the apostle of emotional intelligence, the world-class strategist, and his impact has been felt by so many professionals across demographics and across industries. Thank you so very much for the knowledge that you have shared with us and your personal experience. We really appreciate you. I want to thank Dr. Leonard Okonkwo. Dr. Okonkwo, thank you very much. I must confess that this is the first time I'm meeting you, and I have very good impression about you, and I will still seek to meet you even beyond this this call. We benefited so much from your wealth of experience and the knowledge that you have shared of immense benefit. I cannot forget, you know, the many sources of stress that you listed that we need to really find a way of managing, you know, conflict, frustration, pressure, anxiety, depression. My God. Thank you very much, sir. We still, I can bet you that, you know, we will still seek for you because you have, thank you very much, sir. And, you know, permit me to give a very special thank you to our specialist, psychiatrist in the house, in the person of Dr. Maymunah Kadiri. Let me just shorten it as Dr. May. I love that name. My God. And Dr. May, you have really wowed us today. I can bet you will see many calls, you will receive many inquiries beyond this call. And don't be surprised if you begin to see many people in your office, because honestly, there is no way we can buy this. We can't pay for it. And I must say a very big thank you to you on behalf of the Institute. We are very happy having you. I want to believe, that having given us the very realistic perspective of mental health and the mental illness, even showing that even you as a specialist, you are not immune from mental illness. It's so comforting, so that none of us would think that you are an angel. And it's a call for all of us to really, pay attention, to our mental health. And nobody should be careless about it. Thank you so very much, madam. We really appreciate your presence. Thank you. Thank you very much. And distinguished ladies and gentlemen, what else can I say? I mean, I've been seeing events, moderated webinar, moderated, but I must say I've never seen this one like this today. There's no way I can even match it with so many others that I've witnessed and I've experienced. And all thanks go to our able compare in the person of Ms. Osayi, Alile, M.CIoD. Madam, thank you very much. I will have, in the local parlance, they will say 3 gbosa. We are going to give you more gbosa than 3. Honestly, you are really wowed us, and the way you have moderated, there is no way anybody can miss it. There is no way we can miss it. Thank you very much, madam, for sparing your time out of your very busy schedule. Before this event, I was engaging with, my colleague. I said, I hope madam will have time to attend this program. No, she said you have committed to it, that you have committed yourself to it, that you come. So I thank you very much for coming, not only for coming, for delivering at a very superlative level. Thank you very much, man. God bless you. I want to thank everyone who has joined this call today. Let's just take it as a beginning of knowledge and seek more, because trust me, 2 hours is not enough to make the most of this particular team, and which is a global issue across the world. So please let us go and seek more. And I can easily speak for all our experts in the house that they are available, for us at no cost, to access counseling and knowledge if we need to know more. So we want to thank you for coming, and we look forward to meeting you again in some other programs of the Institute. For the Institute, we have our own takeaways in terms of advocating, in mental health for directors. I mean, we are going to take that as a very serious issue, and I'm sure the president will give us all the backing, the council, they are going to give us all the backing that is necessary in terms of educating our directors in this respect. So thank you very much. We look forward to meeting you all in some other programs that we will have. And I must say that, before long, Mr. Our chairman of Health and Social Security Committee, Mr. Okonkwo, will still, summon us for even better and greater webinar. Thank you very much. We thank you. We want you to we pray that, you will have enjoy the rest of the day. And as we draw curtain on this program, thank you very much. Thank you.
Thank you very much.